All righty, good evening. So we're a little late because we had emergencies going on today. And of course, we are back. And so my promise to all you guys was to kind of do something on a weekly basis. So that's my goal. My goal is to do some presentations so we can guide you. We want you to be healthy. I mean, you know, as we go through this whole process of life, it is easier to stay well than it is to get well, and that's our goal, is to, you know, to stay well, to get you into the most important information for health, for longevity, for avoiding, you know, the autoimmune diseases, because in this country we see so many, and it's ridiculous. And some of the, you know, the doctors that I talk to, and they got multiple degrees, PhD, MD, and, you know, chiropractors and naturopaths and all that. And a lot of them think that it's, you know, it's based on, well, how, you know, we are in our society. We're always kind of more aggressive as far as having to get things done and, you know, the stresses of life. I think it's more of our toxic world. You know, we're in an environment now today, since World War II, there's over 70,000 chemicals in our environment that we're exposed to. So are we capable of eliminating these toxins, these waste products, or are we accumulating them within, which is leading to more of the chronic, you know, health conditions? So if you're not detoxifying, that's a big time mistake. And, you know, I'll get into that in the next live event, because I, again, plan on doing these every week. But tonight's talk, let's get back to that because it's kind of critical, right? So we talked about signs and symptoms. How would you know if you have a thyroid problem, especially if you've gone to your, you know, your medical doctor and they say, well, it doesn't seem, you know, nothing's showing. Well, what are they typically looking for? Well, blood test wise, they're looking for your thyroid stimulating hormone, which is TSH. Well, if we look at the lab reference range, that lab reference range can go from 0.5 all the way to 4.5. So that is a huge area as far as reference range, okay? We know if you're getting below 1, you're going into what we call more of a hyper type of thyroidism. And if you're above that 4.5, that's when we talk about, okay, you're in a hypothyroidism. So what signs or symptoms should we really look for without knowing or understanding that, hey, you know, well, there's been diagnosed as a thyroid problem? Well, look at the size of the neck. The neck is real critical. So when we look at the neck, we're going to see down in here the thickness of the neck. And we see more thyroid problems in women than versus men. Now, why is that the fact? Because of the issue, women have a lot more going on with their bodies, you know, menstruating and hormones. I mean, much more complex than men are. And with women, we'll have a greater tendency to have the thyroid issues. So, thickness of the neck. So if there's a thickness of the neck, that is one sign or symptom that you have a potential thyroid problem. Another one is like back here at the base of the neck, right in this region here, and a person can have what's called a dowager's hump. So it's known as a dowager's hump or a widow's hump. That's what they used to call it, okay? A dowager's hump or a widow's hump. So you can have someone look at you, or you can roll your fingers across that upper back, and if you feel a mound like fatty tissue, that is that dowager's hump, or also called a widow's hump, okay? So that's a tendency right there. That's what we've seen over the years. So we got the thickness of the neck. We got the dowager's or the widow's hump. Another thing is on x-rays, it's going to show up that there's degenerative changes going on in the mid-neck. So what does that mean? Well, an old whiplash could have started that injury. Now, when we say an old whiplash, well, that could be, you know, a fall. It could be skating. It could be snowboarding. It could be, you know, trampoline, it could be dance, it could be cheer, you know, hockey. I mean, there's so many different things that could all precipitate that issue as far as the damage to the neck, commonly referred to as a whiplash type of trauma. We get now the compression on those nerves. Where do the nerves go from the middle of the neck? Into the thyroid gland. And I remember it was like 20 years ago, there was a neurologist, an MD neurologist, that stated that he had noticed that association with that neck issue, and then of course them having, you know, degenerative changes, which of course then having, you know, thyroid issues as well. Okay, I know some people are saying hi and all that, but I see people. Welcome. If you haven't seen our live events before, we're glad to have you here. And, you know, share these events with friends or family, because there's so many people out there that are not being well educated and understood. And our big thing is, and that's what doctor means, is to educate, is to really teach you. So, 3 things we already talked about: thickness of the neck. We talked about the dowager's hump, the widow's hump. We talked about the degeneration of the neck, compressing on nerves that specifically go into the thyroid gland. Now, will you necessarily have abnormal blood tests? No, not necessarily at all, because that comes later on. And again, here's what we're going to do, because from a functional medicine, that's what we practice, functional medicine. We want to get to the cause of the problem rather than just deal with symptoms. So when we look at the cause and we look at the reference range of TSH, and that's only one of about 10 markers that we're going to measure when we do a blood test, because we're going to do what we call a full thyroid panel. So when we look at that blood test, we want your TSH, your thyroid stimulating hormone, to be about 1, you know, maybe 0.8 to about, you know, 2.0, right in that region, versus the lab range, which is 0.5 to 4.5, okay? Now remember, and this is a real key thing, many of the people that have a thyroid problem will develop an autoimmune condition known as Hashimoto's, which is a hypothyroidism component, or they're going to develop a hyper, which is Graves' disease. Okay, so we've seen both of those types, you know, in the office, where individuals have wanted to go more natural method versus just a drug. So remember, the thyroid stimulating hormone, which is measured on the blood test, and the thyroid replacement hormone that might be like Synthroid, it might be Levoxyl, levothyroxine, those type of things, and there is some more natural ones. Synthroid is not natural. That's like the granddaddy of the thyroid replacement hormone. Again, they are not doing anything in the way of fixing your symptoms. All they're doing is balancing out that thyroid stimulating hormone range. But even so, you're going to have issues because a lot of times you're not converting. So, oh man, am I getting some complex stuff. I am sorry about that. But that's why, if you got questions or something like that, hopefully we can answer these questions. So you can post some of your questions. We'll try to get to them. I promise we'll do the best job we possibly can. Okay? So, other things that we're going to notice: thinning of the outer third of the eyebrows. That's a common sign of it. Another thing, thinning of the hair. Okay? Thinning of the hair, losing the hair, that's another thing. Skin conditions, okay? Skin conditions are really associated with thyroid, and they can be food sensitivity as well. If you're tired, if you're constantly tired, oh, that's not normal. I mean, you know, I don't care what age you are, you're not designed to be tired all the time. You're designed to really be go in, get things happen, have the energy that you desire. When it's time to go to bed, you fall asleep, boom, you're out, and then you wake up hopefully 7 or 8 hours later, okay? But that is one of the things that people have is actually sleep problems when you have thyroid issues too, so you're not getting that restful sleep. Another thing is constipation or diarrhea. It's more tendency towards the constipation side. That's classic with the thyroid. Why? Because the part of the thyroid hormone is to create what we call peristaltic action. Peristaltic action is that movement, is all the digestive process and getting things so that we can eventually eliminate. Being cold is really a sign of hypothyroidism. That means, again, your engine, which is kind of like the thyroid, right? It's part of the overall body's engine. It's really low. It's really low. So it's basically sputtering along, so you're cold. Circulation is really poor. Now, because someone can be what we call hypothyroid, but they can go through ups and downs of hypo and hyper, meaning there's times where they got all kinds of energy, their weight is a lot, they're thinner, so they're feeling good or better than they were feeling in the hypothyroid state. So what is the tendency? I think they're back to normal. No, you're not back to normal, but you're going through a hyperthyroidism state. And that's typically, it's a roller coaster ride that takes place with many people. Now understand, a lot of people, because of long-term thyroid dysfunction, are going to develop nodules. And see, we notice that a lot of times when we're palpating the thyroid. So the thyroid is like a butterfly shape. It's a part butterfly on the right side, part butterfly on the left side, and then it's got a little bit of a cross in here in the middle. It's below, and of course if you're a woman, an Adam's apple, it's going to be down lower. So women don't have tendency to have Adam's apples. I got one. So it's going to be below that area. You can palpate that, or you can even have people look at you. If you got a little bit of a bulging here, that means you have the likelihood of having a goiter. Now, goiter is definitely a thyroid issue, and I'll tell you, we've seen patients before that have come in this office and to our seminars that when we had them in office, and they said, I said, why are you here? And I said, boy, you got a goiter, you got a thyroid problem. And they said, well, that's why I'm here, because I was told I don't. And how can you not have a thyroid problem and have a goiter? Because that's a true sign that there is thyroid dysfunction going on. So that takes some, maneuverability as far as really taking care of people to help those people get back into a healthier state. Because really all the iodine is being pushed out into this area, stored in that goiter area. And just another thing to bring it up, because a lot of people think, well, I could just do the iodine, go high amounts of iodine. No, you don't want to do that. There's the elemental form of iodine, free iodine, then there's the other form of iodine, which is a little bit better, but the problem with that is that still it can cause you to blow up into, some major symptoms. So that's treading on fine water as far as getting the person healthy before we're going to introduce the different forms of iodine to help that individual really get their, thyroid in their body working properly. So understand the thyroid's real critical in our body's function, but it's attacked. It's attacked by multiple methods, okay? And the big thing about the thyroid is that there is thyroid receptors in every single cell in your body. What does that mean? It means that hormone is going to attach on that cell, and it's going to get that cell to work. Think about the cells. Now, how many cells in your body? 10 trillion cells in your body. I'm trying to read. I'm going to put my face in there, right? Okay. Of course, it's a little too small, so I can't read. So every cell in your body has a thyroid receptor site. What does that thyroid hormone do? Its job is to turn that cell on, get that cell to work and function properly. 10 trillion cells in your body. Just like vitamin D, there is a vitamin D receptor on every cell. That's why the majority of you thyroid patients, you have very low vitamin D. I mean severely low. And if you listen to past live events, you know that the vitamin D level for even people by itself has been low normal. That's not good, because there's so many different ramifications as far as negative health conditions associated with low vitamin D. So I mean, I'm out playing golf, I'm riding my bike, several times a week. I don't put on sunscreen, It might show, but I mean, I'm not going to put chemicals on my body. There is natural ones like zinc oxide. That's a heck of a lot better thing to use. But we need about 30 minutes of sun, okay? So you want to get a little bit of the sun for absorbability, but again, you don't want to burn. And remember, sunscreens, all they're doing is protecting the superficial layers. So the sun is still penetrating those deeper layers, and that's going to eventually cause problems as well, okay? So one of the things that you can do, what can you do? How do I know if I have a thyroid problem? Look at those signs and symptoms. What did we talk about? Thickness of the neck, dowager's hump, widow's hump. We talked about degeneration of the neck. Only a qualified doctor of chiropractic is going to be able to go ahead, take x-rays of your neck, and be able to determine if that exists in that area. 4, 5, and 6. Those again, there's 7 vertebrae in the neck. 4, 5, and 6 are the direct nerves that are going to the thyroid gland. Losing of the eyebrows, out of the third of the eyebrows, thinning and losing in the hair. I mean, and we've had patients that are just, brushing their hair and clumps of hair coming out. Also, dry skin conditions. That's a big issue. Energy, fatigue is huge. constipation. You know, there's so many more. And another thing is, especially young girls, one of the big things that I thought about just now, that came to my mind, was the fact that a lot of these young girls, before they truly show signs of thyroid dysfunction, they're going to have bad menstrual cycles. So if you've ever had bad menstrual cycles where they've gone on for 3, 4, 5 days, you know, typically time to have a menstrual cycle is 5 days, you're going to go ahead and you're going to see that, of course, you know, it's a heavy flow. And you got to take drugs in order to try to give yourself relief, like over-the-counter meds. And now you're creating another real big issue, because what happens there, you're really destroying your body's, you know, ability to heal when you take even these over-the-counter drugs, affecting your liver, affecting your kidneys, affecting your body's ability to heal. It does interfere with your body's ability to heal. So Anna asked, can I have a problem if I have fibromyalgia with this? Well, that's typically what we see, is that there's other conditions associated. That's a good question. There's other conditions associated with the thyroid. One of them commonly is referred to fibromyalgia. What is fibromyalgia? Well, there's a lot of tender points in the body, a lot of painful points, and there's a lot of fatigue with those individuals, so there's a lot of chronic pain. What is that really? Fibromyalgia is just another form of an autoimmune disease. It really is. And understand, when you have one autoimmune diseases, you have multiple autoimmune diseases, okay? Because it's like a wildfire that's out of control. So you're going to have more and more conditions that are going to develop, okay? So what did we talk about earlier? When we run a full panel blood test, I'm looking at all the inflammatory markers, because those are real critical. It's like putting pieces of the puzzle together. When you get a general one, what they consider a complete full panel, you're not getting that at all. Why? Because the insurance companies dictate what you're going to have, and it's always about minimal testing, no matter how much you nag your doctor to try to get more things happening. We're going to run the antibodies. The antibodies, TPO, TGB, those are critical. And understand that the autoimmune, which is commonly Hashimoto's, a hypothyroid type, is going to be 70% of the time is going to be picked up on TPO. But 30% of the time is TGB. So a lot of times even the endocrinologists are not going to run the TGB. They're going to run just the TPO. Well, guess what we're finding? We're finding more positives lately on the TGB, not on the TPO. So if we just ran the TPO, these individuals would not be considered autoimmune Hashimoto's. But because we run both, we're able to identify both. So that's a real key thing. So a couple things you can do. Find out how your metabolism is. Get a Geratherm. It's spelled G-E-R-A-T-H-E-R-M. It's a thermometer. And you can get that at any of the drugstores, Rite Aid, CVS, Walgreens or whatever, Walmart. You get this, and you're going to take your temperature underneath your tongue. Now the key thing here is you don't want to take it when you get up right away. That used to be the old way of monitoring, you know, how your metabolism. We don't do that. We now do it about 3 hours after you've been up, after you get going. Take your temperature first thing, 3 hours after getting up, then take it a little bit later in the day, start taking and writing down and recording your temperature, because you might not be converting. There's a lot of conversion because we're taking in 93% of the thyroid hormone is coming in as T4. Well, T4 is not the active form. It is T3. So it has to be converted. Where is it going to be converted? It's going to be converted in your gut. It's going to be converted in the, what we call the peripheral tissues. It's going to be converted, you know, in part in the liver. It's going to be converted in so many different areas. And those areas need to be functioning properly in order for your thyroid to function properly. And so hopefully you're getting a little bit of an understanding. Let's see, do I know how much time I've been going on? Because I could probably go on forever. But again, you know, we're trying to make these short, sweet, so that you can listen to them for a little bit of time. Again, if you have any questions, go ahead, send them in. We'll try to answer those. If you're ever interested, we're here. You know, we're here. I work with patients. We work with patients all around the world, actually. We get patients from India and Pakistan and all these other countries because they're having the same type of problems. It's not just here. But again, you know, you have the right to be healthy, and you can get healthy. And soon we're putting together a program that is all about bringing you through the ABCs of getting healthy, what it takes, what it takes if you want to be slender, if you want to have energy, you know. I know that, hey, listen, I've always had challenges with my weight, you know. I've always had challenges. It's not until the last year and a half, I maintained my weight at a great level, and now I'm back at my high school weight, and that's where I want to be. Because what does research show? For every pound we're overweight, that's 4 times the pressure on our joints, okay? So what are the joints that are going to take a hit? Knees, big time knees, you know, hips, you know, those joints of the body. So if you're trying to get healthy and stay healthy, we're the ones that definitely can help you with that. So Dr. Valentine out, and you have a great weekend. And again, if you like these, post comments, share it with your friends, your family members, and others. Like our page, SoCal Thyroid, Doc. Go ahead and let that out for other people, and let's get the word out. Let's get people healthy, because it is your God-given right. Have a great evening.